Good afternoon. We'll now start. Okay. So I'd like to welcome everybody to this pep talk. Please mute yourself, but always show your video picture. Please sign in your name, your Facebook account, including your email addresses. Okay. In the chat box, include names of companions attending. Use the chat box to ask questions and make comments while the pep talk is on. There'll be group pictures at the start and end of the pep talk. As a reminder, please take the OLETE for online learning cube evaluation test exercise for mastery of learning and have a get a perfect score to get certificate. The link has been placed in the chat box as well as the Viber group as well as in the Facebook group. Another reminder, 50 OLETE certificates will entitle one to a voucher for an ROJoson telemedical consultation. And another request, please type in your feedback in the chat box if you're not going to take the OLETE exam. So let's now have a group picture taking before we start the OLETE proper. Okay. 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control of the management of their health. There are 3 courses in the pep talk. I completed the core course on October 9 last year, 2021. And then from October 23, 2021 onwards, I've been tackling health disorder and health issue courses. So this is our 65th or 66th lecture pep talk today. Okay, so this may take 3 years or longer. My pep talk today is entitled Hepatitis, Fundamentals and Generalities to the Medical Management. This is part of the health disorder course. The empowerment objective is to have for the lay people to have an understanding of the fundamentals and generalities of hepatitis in their health management. There are 3 terms in the title which I'd like to explain. Fundamentals, the word fundamentals will be used to mean the basic principles, foundations, and basis. The generalities, the word generalities, majority, not all, not detailed, not specific, and then management will be the medical management usually done by a physician. The contents of this particular pep talk will be the following. What is hepatitis? Different types, different causes. What are the symptoms? Acute and chronic. How to diagnose hepatitis, both acute and chronic. What are the diagnostic tests to firm up suspicion of acute and chronic hepatitis? What are the differences among hepatitis A, hepatitis B, hepatitis C? And what are the concerns with hepatitis B? Inclusive of preventive measures, usual diagnostic tests, and treatment. And what are ROJoson's advocating statements and advice on hepatitis? So most of the content of this particular lecture, of this talk, will be gotten from this particular resource, this link. Let's start with the first topic, with what is hepatitis. Hepatitis is a general term used to describe inflammation of the liver. Okay. So inflammation pa lang, you can call that hepatitis already. When you have infection, you can also have hepatitis. So inflammation is the first stage of infection. But sometimes inflammation does not proceed to infection. What are the different types of hepatitis? Basically, hepatitis can be classified into acute or chronic. Acute means which occurs suddenly and then goes away, biglaan dating, biglaan wala, okay? In a short while, in a few days, mawawala na siya. But if the when you say acute, the period of inflammation lasts less than 6 months. Okay, we categorize that as acute, and then there is a normalization of the liver function test. Initially, baka abnormal, then after a while, naging normal. Okay, so if the inflammation lasts less than 6 months, okay, not 3 months, 2 months, now it's still acute. If the inflammation persists beyond 6 months with derangement, with abnormality in the liver function test, then we call that chronic. So between acute and chronic, yung chronic ang more worrisome because there's a risk for permanent kasi ma-under pa yung inflammation. Okay, so there's a risk for permanent liver damage, which we call cirrhosis in medical terms, and liver cancer. So mas nakakatakot yung mga chronic hepatitis compared to acute. What are the different causes of hepatitis? So here is a list of the different causes. Viral hepatitis caused by the virus. This is the most common cause. Then you can have also drugs, alcohol, chemicals such as the dry cleaning solvent carbon tetrachloride and vinyl chloride used to make plastic. And then parasites such as amoebic hepatitis, certain genetic disorders, and overactive immune systems that mistakenly attack the liver called autoimmune hepatitis. Now, as to the viral hepatitis, this is caused by different viruses. What has been published in literatures are that hepatitis A, B, C, D, E, G can cause hepatitis. These are the viruses that can lead to viral hepatitis. In the Philippines, the more common are hepatitis A, B, and C. So we will just be concerned with these three types in this particular PEP talk. Now, drug-induced hepatitis, usually caused by drugs when taken in excess or in very high doses. This can cause hepatitis. Example, paracetamol. That's why there's a limit as to how many tablets you can take per day only. Okay. Vitamins, particularly vitamin A. Okay, so not all vitamins are safe. And herbal medicine, a lot of new ones, no? Okay, not those which are not approved by the FDA can cause hepatitis also. Food supplements also. So beware of all these drugs. What are the symptoms of hepatitis? So first of all, not everyone will develop symptoms. So there's such thing as asymptomatic as well as symptomatic patients. Asymptomatic hepatitis are those patients with hepatitis but without symptoms. Okay, parang COVID, asymptomatic COVID. Okay. Symptomatic hepatitis, patients with hepatitis but with symptoms, which I will enumerate later on. So although majority of adults, 70% develop symptoms, in contrast, young children do not. Okay, so young children do not usually develop symptoms. So adult and children over 5 years of age are more likely to have symptoms. So below 5, usually walang symptoms yung mga bata. And what are the symptoms of acute hepatitis? As I said, we divide hepatitis into acute and chronic. So a lot of times the symptoms of acute hepatitis are non-specific. So initially, and then at times it can just mimic yung mga flu-like symptoms, okay, such as may fever, may cough, may colds, may fatigue, no? Okay, dyspepsia-like symptoms, you have loss of appetite, no? Nausea, vomiting, abdominal pain, and gastro-like symptoms. Okay, usually non-specific that you cannot really. Sometimes, a lot of times, you cannot differentiate it from flu, dyspepsia, and gastro. Okay. But the moment you have dark urine or the so-called tea-colored urine, parang tsaa, no? Or clay-colored bowel movement, clay-colored stools, no? Then you and also jaundice, naninilaw ang mata at the skin, then you start thinking of hepatitis already. Okay. Now here, when you say diarrhea, it's only seen in hepatitis A virus. Okay. How to recognize and diagnose acute hepatitis? So you use a pattern recognition cues for acute hepatitis in general, but not the specific cause yet. Okay, as we said, there are a lot of different types of hepatitis. Okay, you just say hepatitis, but a lot of times you don't know whether it's A, B, C. Okay, so the most reliable cue will be, aside from the non-specific symptoms, flu-like symptoms, dyspepsia, gastro-like symptoms, once you have this jaundice and tea-colored urine, and then a tender liver on palpation on the abdomen, now you start thinking of hepatitis already. But if you don't have jaundice, you don't have tender liver, most of the time you think of the flu, you think of the dyspepsia, you think of the gastro. Okay. But once you have this jaundice, yan ang pinakamalakas na clue that you might be dealing with hepatitis already. So the specific cause can be suspected just based on the presence of the triggers. Okay. So if the patient is taking a lot of drugs, then you suspect drug-induced hepatitis. If the patient has a history of amoebiasis, now you think of amoebiasis hepatitis. Okay. Then also based on the prevalence, what is most commonly present in the community. Okay. So this is the basis for suspecting the specific cause. Now, what are the diagnostic tests to firm up a suspicion for acute appendicitis? Nasa acute pa rin tayo ngayon. Okay. So these are the tests usually done: liver function test, hepatitis panel, ultrasound of the liver. Liver function tests are blood tests used to help diagnose and monitor liver disease or damage. Okay. So the liver function tests are not specific for hepatitis. They may be implied only. Okay. So the indications for doing liver function tests are the following. You screen for liver infections such as hepatitis. This is screening mo na. Monitor the progression of the disease such as viral or alcoholic hepatitis and determine how well a treatment is working. So monitor mo lang yung progression and how well the treatment is, how patient is responding to the treatment. And then you also measure the severity of the disease and then monitor the possible side effects of medications. So these are the indications for liver function tests. So examples of liver function tests, these are usually they determine the levels of certain. Okay, sorry, na photo. So there's a disruption from the internet. So let's resume. So liver function test will consist of the following: alanine transaminase, aspartate transaminase, alkaline phosphatase, albumin total protein, bilirubin, etc., etc. Marami yan, no? Okay. So one has to decide whether to do a selective or all of the. This is the panel. Okay. If the cost is, sometimes the laboratory has a package that the cost is this match, and then if you select one or two, it will be the same cost. Then you might as well get all the package already. If not, kung mura lang isa o dalawa lang, then you can choose either ALT, alanine transaminase, because this is more specific for liver diseases, and then bilirubin if you have to examine the level of the yellowing of the sclerae. Hepatitis panel, the next type of diagnostic test that can be done for the liver. So once hepatitis is strongly suspected, both clinically and through the liver function test, one now can order the hepatitis profile. But if you are suspecting drug-induced or chemically induced hepatitis, there's no need for hepatitis profile. Okay. So you have to be watchful for this, because most of the doctors, they just order hepatitis left and right, even though if it's not due to hepatitis, parang routine na yon. But usually there's a cost to it. Hepatitis profile is a group of blood tests that check whether one has a viral hepatitis infection now or had one in the past. It may also show whether one is immune to certain types of hepatitis. So you can have hepatitis A panel. This is done to detect hepatitis A as well as to evaluate it. Then hepatitis B, then hepatitis C, and then sometimes they include a package that will include everything, A, B, C. Okay. So again, what test to order? It can be selective or all. Okay. So it depends on if you're just firming up a suspicion or probable virus as present, you can just be selective, just choose one. Example, if you're just suspecting B, you just choose hepatitis B. You don't have to do hepatitis A. Then again, it will depend on the budget of the patient and also the organizational requirements. Some agencies, some institutions will require you to have all. Some will just say hepatitis B. Ultrasound of the liver, the indications will be, this is our indications for patients with probable hepatitis. Okay. You want to screen, you want to diagnose, you want to monitor the extent of the scarring. Kasi pag nagkaroon ka ng hepatitis, you can have scarring of the liver already. No? Okay. So you want to check the extent of scarring. And then you want to rule out other probable diseases in the liver. Baka may iba pang sakit. No? But in chronic hepatitis, the ultrasound will be used to screen, diagnose, and monitor for the complications. And as we know, that the dreaded complications of chronic hepatitis are the cirrhosis and the liver cancer. So yung ultrasound can easily detect these two. Okay. Now, as to the chronic hepatitis naman, earlier we were talking about acute, now for the chronic. Most people have no symptoms or feel healthy for many years. Let's say after the acute hepatitis, walang symptoms yan. Walang nararamdaman, but slowly, nagkakaroon siya ng chronic hepatitis. But not all patients with acute hepatitis will have chronic hepatitis. Yung mga pumupunta sa chronic hepatitis, walang nararamdaman. Okay. So about 15 to 25% develop complications in the liver, such as cirrhosis, as I mentioned earlier, liver cancer. In the earlier stages of liver cirrhosis and liver cancer, the patients may remain to have no symptoms kasi maliit pa. Okay. So symptoms will thus be associated with cirrhosis and liver. So pag meron ka ng cirrhosis and liver cancer, usually you experience this thing. Chronic fatigue, palaging pagod, jaundice, naninilaw, liver mass. If there is cancer already, makakapa mo na yung bukol. No? The diagnostic test for chronic, para lang sa acute, you can start with liver function test. Then, if you're suspecting hepatitis panel, and then ultrasound of the liver. Okay. Pwedeng one at a time. Okay. Huwag yung sabay, baka hindi kailangan. The next question will be, what are the differences among hepatitis A, B, and C? All these three, these are the most common, as I said. Okay. They may have similar symptoms. Okay. A, B, C can have similar symptoms, and they are caused by different viruses. Let's start with hepatitis A. Hepatitis A is acquired through intake of contaminated food and drink. It is self-limiting, kusang nawawala, okay, nare-resolve without specific treatment. Okay. Pahinga lang. Okay. It is an acute infection, meaning it is newly acquired and does not cause people to become carriers of the virus for a long time. Hindi siya nagiging chronic. So hepatitis A, pinakamaganda. Okay, if you have to have hepatitis. So symptoms usually include diarrhea, especially hepatitis A. Kasi pagkain, no? So for hepatitis A, it has a vaccine for prevention and protection, usually 2 shots at 6 months apart. The estimates for long-term protection for fully vaccinated people, usually full 2-dose series, suggest that protection from hepatitis A virus could last for at least 25 years in adults or at least 14 to 20 years in children. So ang kabutihan dito, once you fully recovered from hepatitis A infection, you usually develop antibodies which protect you for the rest of your life. Kung wala ka pang history of hepatitis A, then you may develop hepatitis A. If you want to prevent it, now you can have vaccination for that. How is hepatitis A treated? So the treatment is usually you just treat the symptoms. Okay? Usually doctors recommend rest, adequate nutrition, and fluids. So walang mga gamot na, just rest, nutrition, and fluids. So but some patients can have severe symptoms which need medical care in the hospital. Pero bihira lang ito. Now let's go to hepatitis B and C this time. So these are infections that can be acquired from infected blood. Infected blood, yung mga blood transfusion, yung mga doctors, nurses working with blood, laboratory workers working with blood, kumisan they are exposed to infected blood, and also infected body fluids. Aside from the blood, it's the mga fluids. Okay. They can also begin with acute infection, okay. But in some viruses remain in the body, causing lifelong infection that may cause complications such as liver cirrhosis and cancer. So let me emphasize, in contrast to A, yung B and C are infected through infected blood and fluid, whereas hepatitis A acquired through contaminated foods and drinks. In the Philippines, around 1 to 10 in 10 have chronic hepatitis, and 6 in 1,000 have chronic hepatitis C. So that's why it's chronic hepatitis B is more common than chronic hepatitis C. Okay. So I have to emphasize the word chronic. There's such thing as acute hepatitis B. So some of them get well without any problem, but some would go into chronic hepatitis B. Yan ang nakakatakot. Okay? Ganun din sa chronic hepatitis C, some would go into acute. No? Pag naka-recover sila completely, walang problema, they get antibodies. But for those who are partially recovered, they can go into a chronic stage, which is more dangerous. So vaccines, in terms of vaccines, yung hepatitis C, walang vaccines. No? Hepatitis B naman, meron. You can have vaccination, okay? And these are quite effective and safe. Okay. The curability of chronic hepatitis B and curability of chronic hepatitis C. Chronic hepatitis B at present cannot be cured. Kaya yan ang problema sa Pilipinas, no? Okay. Medications are being given. Mahal yung mga medications, but it's just given to slow down the complications, to slow down the development of cirrhosis and also the liver cancer, to avoid the liver cancer kung pwede. No? Chronic hepatitis C at present, luckily, can be cured. So the pills can often be taken for 8 to 12 weeks, that's about 3 months, and have a cure rate of 95% or greater. Medications for chronic hepatitis B and C. Okay, here is a list for the chronic hepatitis B. Okay, I won't read them anymore, but just remember that these are very expensive. Then this is another list of drugs, but this is for the chronic hepatitis C. So direct acting antivirals. This is what they're usually called. Okay, again, they're very expensive. Okay. So what are the concerns with hepatitis B? Let's now focus on hepatitis B. How common is hepatitis B in the Philippines? Hepatitis B is a major health concern in the Philippines. An estimated 7.3 million adult Filipinos comprising 16.7% of the adult population, are chronically infected, so making the country very hyper-endemic for hepatitis B. A 2003 survey showed the prevalence of hepatitis B to be highest in the younger age group, 20 to 49. So which comprise the workforce and those entering the workforce. Kaya yan ang problema, okay, workforce. And what are the, okay. So hepatitis B is an infectious disease, as mentioned, of the liver, caused by hepatitis B virus. In the acutely newly acquired phase, the symptoms may be similar to having flu, and some, and not all, can have jaundice. But the moment you have jaundice, you start suspecting hepatitis. Okay. Okay. Usually, kung wala namang history of contaminated food intake, usually think of hepatitis B, because between hepatitis B and C, more common ang hepatitis B. In some patients, hepatitis B can become chronic. Okay, so as I said, not all patients with hepatitis B can go into chronic, some lang, okay? So meaning when you say chronic, it can be for a long-term or lifelong infection. And again, to emphasize, patients or persons with chronic hepatitis B are at risk for liver cirrhosis and liver cancer. Again, to emphasize, the concern with hepatitis B, no cure for it at present. Although the good news is that usually it goes away by itself in 4 to 8 weeks. Okay, so more than 9 out of 10, okay, 90% they totally recovered. However, 1 in 20 person who get hepatitis B becomes carrier, and then which means they can go into the chronic stage. Okay. Another good news is that there are effective and safe vaccine against hepatitis B. So it has to be given before the infection occur. Yan ang hitch doon. Okay. So in terms of transmission and exposure, meaning how one can get hepatitis B, hepatitis B is spread through blood, semen, and other body fluids, in contrast to A, contaminated foods and drinks. Okay. So a person can acquire this by through birth, panganganak, spread from a hepatitis B positive mother to her baby, sex with an infected partner because of the body fluids, the semen, sharing of needle, syringes, and other drug injection equipment with an infected drug, usually mga drug addicts, sharing razor, nail clippers, manicure or pedicure with an infected person. So make sure when you have a pedicure, manicure, make sure that the clippers, the razors are clean. Direct contact with the blood or open wounds of an infected person, usually mga health workers. Exposure to blood from needle sticks and other sharp instruments, okay, mga health workers like me. Okay. Since the Philippines is considered a hyper-endemic hepatitis B, almost everyone is without any antibody pa or vaccine can be infected. So who are at risk, as I said, aside from those mentioned, hemodialysis patients can also, because you're dealing with blood, you can be infected with hepatitis B. Okay. Now the question is, as I said, the starting point is that you have acute hepatitis B, and then what happened next? Okay, some would fully recovered, some would go into lifelong infection or chronic hepatitis B. So one factor is that it depends on the age that one gets exposed or infected. Studies have shown that the younger a person is when he gets infected, the higher the chance that he or she will have a lifelong infection with the virus. Yeah, yung mga bata, if they get infected, baka there's a more risk for them to develop the chronic infection. And 90% of infected infants will develop chronic infection. The studies have shown that. That's why yung mga bata ngayon, yung mga at birth, binavaccinate na kagad. Okay? And approximately 25 to 50% of children infected between 1 to 5 years of age will develop chronic infection. Again, bata. Okay? and the risk of infection is only 6 to 10% when you are over 5 years of age. The same is true in the world. Most people with chronic hepatitis acquired infection at birth and during early childhood, majority. And how serious is chronic hepatitis B? It is a serious infection that can result in liver damage, liver failure, liver cancer, and death. And the liver cancer is the third most common cancer in the Philippines. It is fatal when diagnosed late and left untreated, making it the second leading cause of cancer death in the country. Who should get vaccinated against hepatitis B? Okay. So all infants starting with the first dose of vaccine within 24 hours of birth, and all children and adolescents younger than 19 years of age who have not been vaccinated as much as possible, then people who have sexual partner with hepatitis B, sexually active persons with multiple partners, those who are undergoing treatment for STD or sexually transmitted diseases, men who have sexual contact with other men, people who share needles, syringes, and other drug equipment, drug addicts, people who have close household contacts with someone infected, and then health care and public safety workers at risk of exposure to blood and blood contaminated fluids on the job, mga hospital workers, okay, and then patients with end-stage renal diseases including pre-dialysis, hemodialysis, peritoneal dialysis, and home dialysis patients. And of course, yung mga residents and staff of facilities for disabled persons, persons with chronic liver disease, aside from hepatitis B, person with HIV infection, and of course, anyone who wishes to be protected kasi takot, no? To be, they can have the vaccination. For long-lasting immunity, usually sa children, 3 to 4 doses depending on which type of vaccine. There are several types of vaccine. Children usually get their first dose at birth and then complete the series by age 6 months. Usually the baby usually get the second dose at 1 month old and then the third dose at 6 months. Tapos na. Kung di pa na-vaccinate, you can do a catch-up vaccination. Okay. So what is the hepatitis B panel? Okay. The panel will be used to check if you have hepatitis B. Hepatitis B panel, very specific. It's not hepatitis A, it's not hepatitis C. So we're talking about hepatitis B panel. So hepatitis B panel is done to check, number one, if you have acute or chronic infection, whether you have recovered from the infection. These are the information that you can get from the hepatitis B panel results, whether you're immune to hepatitis B, and then whether you need to be vaccinated. Because those patients, some people who are already immune to hepatitis B do not need to be vaccinated anymore. They got the antibodies through naturally acquired infection. They completely recovered. Okay. So these are the tests. I won't go through each one of them. Marami yan, very complicated. But basically, we look at the hepatitis B surface antigen. Ito yung pinaka-importante doon. If it's positive, then it means you have the infection. If it's negative, then you're not infected. And then you have to couple it with the antibodies information. If you have a lot of antibodies, which could be positive or let's say this is positive, but you have antibodies, that means you might be protected already. Okay. So a lot of tests, I won't go through them one by one, but the information that will be given to you, whether you are infected or not, whether you are immune, okay, whether you need the vaccination. Okay. So what are the treatment for hepatitis B? Let's start with the acute one. So the treatment is mostly supportive in the form of rest, adequate nutrition, and hydration. Okay. For severe cases, you may have to be hospitalized. And then for chronic hepatitis B, there are drugs available. Okay. So if the vaccine was not able to prevent the chronic hepatitis B, then you make use of the drugs. Okay. So the choice will depend on several factors. Okay. Then, so even those without symptoms, they may diagnosed through the hepatitis B panel showed to have chronic hepatitis B, but without symptoms, they need long-term monitoring for early detection of the dreaded complications like cirrhosis and liver cancer. Now, how can you help keep your liver stay healthy if you have hepatitis B? People infected with Hep B should have regular checkup with their doctor. Alcohol intake should be avoided. Infected individuals need to consult their doctor before taking medications, baka may mga side effects, especially herbal supplements and over-the-counter medicine. And then to stay healthy, you need to control your obesity, diabetes, and cholesterol. So what are my advocating statements and advice on hepatitis? Be aware of hepatitis. Know how to recognize hepatitis in yourself and in others. You have to know hepatitis in other people so that you can avoid them. Beware of hepatitis B in particular, because this is the most dangerous virus. Be aware of preventive measures against hepatitis A, B, and C. Then all newborns should have hepatitis B vaccination. So ngayon mukhang wala ng problema because usually routine na yan, kasama na sa vaccination package, hepatitis B. If you are a high risk for hepatitis B, go for screening for Hep B panel, and then have a Hep B vaccination if needed. So summary and takeaway, I have discussed all these items. What is hepatitis, different types, different causes, symptoms, and then how to do diagnostic tests, differences among A, B, and C hepatitis, what are the concerns with hepatitis B, and then what are my recommendations. So takeaway in relation to patient empowerment, be always in touch with reliable medical information on hepatitis in general. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment, kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in medical management of yourself or oneself by knowing the fundamentals and generalities of hepatitis in your health management. With that, I end my pep talk this afternoon. I hope I have empowered you to have an understanding, better understanding, and fundamentals and generalities of hepatitis, which you can use in your health management. Before we go to the QA and interactions, open forum, please take the online learning kung evaluation test exercise. Please take the, please try to have 50 OLETE certificates. And then those who are not taking the OLETE, I need your feedback. Please type in your feedback in the chat box. So let's now have a group picture taking. Okay. 1, 2, 3. Okay, the floor is now open for questions, reactions, comments, consultations, short consultations. How many have hepatitis already? Me, I'm already protected from hepatitis B. I have myself checked already. So I have negative hepatitis B antigen I have antibodies, meaning I'm protected already. Okay.
Doc, may I say something?
Sure.
Okay, this is Susan. You correct me if I'm wrong, but you said earlier that it's better that children be protected from hepatitis, even at birth through vaccination.
Yeah.
Okay. I don't remember, of course, with my at my age, I don't remember that I had been vaccinated from hepatitis. How can I still be protected aside from not eating those infected food and all that stuff? Do I still need a vaccination like what they did with COVID?
So just like you, I think we're of the same age. I did not also receive that hepatitis B vaccination at birth. Okay. So along the way, as I grow older now, and as a doctor, I'm exposed to a lot of patients, the body fluids now, okay, the blood now, so which make me at risk for hepatitis B, right? Okay. But I had myself checked. Usually, it's a requirement also for the doctors and nurses to have their blood test checked. Even probably I have it checked only about 5 years ago, 5 or 10 years ago now. So I must be 60 something. So because your question has reference to age kasi kaya binabanggit ko yung age, di ba? Okay. So at your age, kung wala kang symptoms and then you are not at risk for the yung high risk for hepatitis, yung A naman, you can avoid it, di ba? You can avoid by eating the mga clean food, no? Okay, probably wag yung kakain doon sa mga kariton na gano'n, maraming hepatitis doon. No? Usually, I don't eat sa mga, yung mga tinutusok-tusok, halo-halo. Okay. Now, if you are exposed to, if your lifestyle is not, you're not exposed to a lot of, you're not exposed to drug addicts, you're not exposed to yung mga their blood elements, then you can choose not to have to, no? But if you want to make sure, no, you have yourself check muna hepatitis B panel, okay? Then if it shows that you are already protected, baka you had infection in the past which you did not recognize, no? Parang ako, probably I got infected also with hepatitis B, but I was asymptomatic, no symptoms, but my body developed antibodies already. Yeah, as I said, I am protected. I was not vaccinated. No? So there could be a natural protection. No? So if you really want to, you're concerned about the status of your hepatitis B, we're talking about, let's just focus on hepatitis B na lang, okay? If you're concerned with hepatitis B, you have yourself checked, have a hepatitis B panel, no? Okay. So if you don't like to have it checked, if you don't want to know the results, just keep yourself healthy lifestyle, no? Okay. Just think of all those things that will, let's say, if you're going to have blood transfusion, make sure that yung mga blood that will be transfused to you are not contaminated with hepatitis B. But usually, as it's a routine now that hospital test the blood for hepatitis B. So to make sure that there's no hepatitis B in the blood that you're going to receive. Okay. Okay.
Another thing, I hope you don't mind, Doc.
No, I don't.
I noted that you said that one of the causes also of HEPA is supplements. What supplements are these?
Supplements, which one? Hepatitis. No, I didn't mention about the supplements. Yung drug induced, the drug induced, okay? So there's a category of hepatitis, diba? Drug induced or food supplements, no? Okay. So yung mga herbal medicine, that just put it as part of the, kasi loosely speaking, we use yung mga supplements, yung mga herbal medicine kasama na doon, no? So a lot of them can cause toxic reactions to the liver, no? So a lot of them, I don't know which one. I'm not worried of that now. Okay. So my personal practice, I don't take all those herbal medicine. No, I don't take all those supplements. No. Okay. Okay.
Thank you, Doc.
Okay. So natural food lang as much as possible. No, because you don't know what will be, maraming offer sa market sa internet, di ba? So you take this food supplement, it takes, no. So the hepatitis that you will get is the toxic, the chemical hepatitis, not the viral, no. Okay. Any more questions?
Doctor, what is ascites?
Ascites?
Ayan,
May binanggit ba ako ascites? May
there
binanggit-
is none.
Okay.
Wala. Pero sa liver din ba yon?
Okay. So I was just wondering whether I mentioned ascites. Hindi, okay. So
No, no.
ascites may fluids sa abdominal cavity, excessive fluid, no? Which normally we have small amount of fluid in the body cavity, yung abdominal cavity, but the moment it becomes excessive, no, too much, then you call that ascites, no. Now, ascites can come from a lot of things. Usually, kung may cirrhosis ka, you can have ascites. When you have obstruction, when you have kidney diseases, no? Then you can have ascites. When you have heart failure, pwede ka pa rin magkaroon ka ng ascites. Maraming possible causes, no? Okay. Okay. Did I answer your question? Bakit ascites ang naisip mo?
Kasi I thought, pag may ascites ka, it usually comes from the liver.
Yeah, a lot of times, no? But as I said, parang edema rin yan eh. You can, when you have a person who have edema sa paa, pedal edema sa paa, we usually look also kung meron siyang fluid. Kasi edema is excess fluid sa paa, di ba? So we also look at the fluid doon sa abdomen. Kung meron sa abdomen, it's something more serious, no? And then kung merong ascites sa abdomen, then we start thinking of the three possible common causes: the liver, the kidney, and also the heart, no?
Okay.
So yung clue that you have kidney, you have liver disease would be you have usually jaundice with ascites, no? Now, if you have sa kidney naman, usually if you have kidney failure, konti lang iniihi mo, no? Okay, then you have ascites, no? So that's the cause, no? Sa heart naman, kung normal lang liver mo, normal yung kidney mo, yung heart mo naman nagsishow ng failure kasi hindi nagpapump ng maigi, no? Hindi bumabalik yung mga tubig doon, then you think of the heart as the source of the ascites. Okay. Any more?
Yeah, there's a question from Melingo. Doc, can someone who has recovered from Hepa B still transmit it through body fluids?
Recovered completely from,
Hepa B.
when you say complete nito kasi who has recovered from Hep, as I said, meron kang acute and chronic, no? So make sure the patient is completely protected from Hep B. If he is completely protected from Hep B, kung matatransmit niya sa body fluid, wala na kasi wala na siyang hindi na siya infected. Diba? Wala na siyang infected. Pero kung chronic hepatitis B siya, no? Okay, he recovered from the acute one, pero meron pa siyang chronic, tumuloy sa chronic, and then ibig sabihin, meron pa yung virus doon, no? Then he can transmit that hepatitis B virus to other patients. Gets? Get it? Melly?
Oh, yes, Doc. Ano yun, Doc? Tetest siya ulit ng HEPA B panel.
Hindi. Okay. Kung wala pa siya, magpa-test siya. Di ba?
Oo.
So, ganun yan. Once, let's say you have, mag-umpisa, sabihin natin may symptoms ng pasyente, acute. Nagkaroon siya
Oo.
acute na sinususpect siya ng Hep B. Okay? So, then, one scenario is meron siyang Hep B panel. Isang scenario kasi a lot of times we don't do, parang ako, I don't do Hep B left and right. No? Okay? Meron siyang Hep B panel that showed that fully recovered na siya. Meron siyang positive nga yung ano niya, dati, positive yung antigen niya, pero may antibodies siya. No? Okay. Ibig sabihin, naka-recover na siya. No? Okay? Protected na siya. So, so hindi na siya magta-transmit ng Hep B to other people. No? Pero kung over the, let's say, naka-recover siya, and then, recover in terms of yung acute phase, no?
Yes.
And then kung tuloy-tuloy pa yung naging chronic siya, ibig sabihin hindi pa completely recovered. Merong mga asymptomatic infection siya, no? Yung mga silent infection. So infected pa rin siya, he can transmit that, he or she can transmit the virus to other people. Okay. So I think the best way is to get the yung information that you want, no, is to have the Hep B panel na lang, no.
Oo.
Okay.
Doc, yung pag sa baha, di ba yung ihi ng daga, pag na-affect sa open wound, is that HEPA A?
No, leptospirosis yun.
Leptospirosis pala doon. Ako nagkamali.
Leptospirosis yun. Hindi siya hepatitis. Hepatitis A yung pagkain.
Ano, Doc, malaman kung food poisoning or HEPA A? Kunwari, nag-diarrhea, vomiting. How will you differentiate kung food poisoning siya or HEPA A?
Mahirap. Okay, some clues will be baka yung kinain, i-try to trace back ano yung kinain mo, no? At kung affected lahat ng tao, no? A lot of times mahirap i-differentiate unless you have a Hep A panel, hepatitis A panel. But kadalasan hindi na ginagawa yung panel yun kasi in due time makaka-recover naman siya, no? Usually kahit na food poisoning or hepatitis A, 1 week or basta rest lang, nutrition and fluids, na nakaka-recover na siya, no? So mahirap ko minsan, if you really want to know kung anong talagang meron ka, kung Hep A ka, then patest ka, di ba? Pero if it will not matter in terms of yung long-term effect, wag na lang. Okay? Okay?
Thank you, Doc.
Any more questions?
Sir, pareho bang nakakahawa ang acute and chronic hepatitis or just the chronic one?
Acute, pwede hindi makahawa kasi meron pa siyang virus. Okay. Yung chronic, nakakahawa rin yun, no? Kasi may virus pa rin siya. No? Okay. So yung acute one, pag naka-recover na siya at nawala, I mean, safe na to interact with that patient, with that person. Pero kung tuloy-tuloy pa yung niya, yung chronic hepatitis B niya, yan ang delikado. No? Okay. Yeah,
Doc,
yeah, sige. Go ahead. Sino?
If let's say you're going to hire a house help, to be safe, anong blood test ang papagawa mo sa kanya? HEPA, what
B na.
panel?
B
Ha?
na lang, B. B.
HEPA B panel.
Oo.
Lahat yun, Doc, lahat. Yung sa HEPA B panel, lahat yun.
Usually, mga 5 yon, limang elements yon, no?
Oo.
Okay. So, kasi yung Hep B panel will tell you kung meron siyang usually, yung house help, usually walang symptoms, di ba? Kung meron
Yes.
kung meron siyang chronic hepatitis or not, no?
Mm-mm.
Okay.
Mm-mm.
Kung wala, kung nakakita meron siyang dating infection, pero may antibodies na siya, safe mo na i-hire siya kasi may antibodies na siya, di ba? Okay.
Mm.
Ganon. At titingnan din another information kasi sabihin na okay, kailangan magpa-vaccinate ka muna, di ba? So you have to have your maid, yung maid to be hired to have vaccination to protect the family. Now,
Oo. HEPA B injection.
HEPA B,
Vaccine.
HEPA B, vaccine kung kailangan. So before you go for adult, before you go for any Hep B vaccination, magpa-Hep B panel ka muna para may
Yes.
guide ka. Na? Okay. Any more?
Thank you, Doc.
No questions in the chat box na, Abet? Okay. So, last call. It's 3:10. If there are no more questions, we'll call it a day. Pwede na?
What's the next topic for next week?
Okay. Ang next topic will be
Vaginal uterus na. Pero tutuloy pa rin yun.
mhm.
Yung bukas ko niya. Pero pinag-figure siya.
Ang next topic,
Metformin. Kailangan daw niya.
may nagsasalita. Okay. Ang next topic will be swallowed fruit seeds. Yung nasa swallowed,
All.
swallowed fruit seeds, is that a cause or no cause for alarm? Is that interesting enough for you?
Yeah.
Yung mga swallowed na
Buto ng santol.
buto ng santol, buto ng kamatis, buto ng lahat ng klaseng buto na mga prutas, no? Di ba? Okay sa inyo?
Yes.
What's
Okay.
lang, Doc? How about vegetables?
Vegetables, ano about may seeds pa yung
Patola. May buto.
may
Patola.
sama na natin inclusive na yung mga buto. Fruit na lang muna.
Vegetables.
Fruit mo na lang. Fruit na lang. Kasi some of the vegetables are classified as fruits, pero magulo di ba? Okay. Okay. Basta importante may bato, may seeds. Whatever it is. Okay. Okay.
Thank you, Doc.
Okay, so let's call it a day. We'll see each other next week. No? Okay.
Thank you,
Thank you
Doc.
very much, Doc.
Bye-bye.
Thank you.
Thank
Bye-bye.
you, Doc.
Bye-bye.
Bye.